People have been taking L-tryptophan for more than 10 years without ill effects as far as anyone knew. Like vitamins, it was available without prescription. When broken down in the body, it produces a chemical called serotonin, which is believed to play a role in controlling appetite, relieving pain, and inducing sleep. On October the 27th, Mayer suggested that Hertzman speak with Dr. William Blevins, who had taken over Bishop's case while Dr. Greenfield was away. The conversation unnerved Blevins. His own wife's doctor was recommending she take L-tryptophan supplements as a standard treatment for premenstrual syndrome. Immediately, Blevins telephoned Gleich in Minnesota. 2 cases weren't enough to mean anything, he told Blevins, but to wait and see. That same day, Blevins received a call from another doctor whose patient had eosinophil, an eosinophil count even higher than Kathy Lorio's. Is she on L-tryptophan? Blevins asked. Why, yes, he replied. 3 cases now. Blevins called Gleich, who contacted the Center for Disease Control in Atlanta and New Mexico's Health and Environment Department. The CDC altered all state health departments. Back at St. Vincent, Blevins was mentioning the 3 eosinophil cases to a friend when Dr. Donald Romeg, an infectious disease care specialist, overheard and interrupted. Bill, he said, I think I've got another one. Muscle aches, eosinophilia, and she's taking L-tryptophan. Meanwhile, a colleague of Gleich's at Mayo Clinic told him about a Missouri man with eosinophilia who was taking L-tryptophan. Another colleague had a patient from Mississippi on the supplement. With cases now occurring outside New Mexico, Gleich hurriedly called Atlanta. Already the CDC was getting a firestorm of calls about eosinophilia cases around the country. The Albuquerque Journal had run an article about the malady, provoking even more media attention and public concern. Answers were needed fast. On Thursday, November the 9th, a CDC investigator and several officers from the Food and Drug Administration flew to New Mexico. The team would survey 2 groups of subjects, eosinophilia patients and control group without symptoms. Both groups would be questioned regarding risk factors, including L-tryptophan use. If the supplement was causing the illness, there should be many more sick patients than controls who reported having used it. When the FDA officers picked up the L-tryptophan samples, the known eosinophilia patients, the remaining investigators combed hematology records from 9 New Mexico labs looking for unusually high eosinophil counts. By Friday night, they had several candidates. On Saturday morning, the investigators and a team of nurses fanned out. For each eosinophilia patient, they needed to find and survey 2 symptom-free individuals of the same sex and age group and from the same neighborhood. By midnight Sunday, the investigators gathered around a computer for the results. All 10 people in the eosinophilia group had taken L-tryptophan. Only 2 of the 20 members of the control group had used it. L-tryptophan was definitely the culprit. On Monday, November the 13th, the New Mexico Health and Environment Department banned the sale of L-tryptophan. The FDA later followed with a nationwide recall. A $60 million industry was shut down. By November 16th, the CDC had received reports of 243 potential cases of eosinophilia in 35 states and the District of Columbia. The new disease was even given a name,